Hello, my name is Denisse Mera. I study medicine and I want to share a topic that you may find interesting. Is a cholesterol embolization after transcatheter aortic valve repression. Definition. Cholesterol crystal embology is a complication of the atherosclerotic disease caused by the occlusion of the small arteries, by cholesterol crystal embology deriving from the eroded atherosclerotic plaques of the large arteries. CCE is a multisystemic and serious disease that affects many organs. Disease diagnosis should be considered among elderly patients with the cardiovascular risk factor and a precipitating factor who develop renal failure and a typical cutaneous manifestation. Due to both frequency of the cutaneous manifestation and importance on the early diagnostic, the role of dermatology is basic in the diagnosis of this process.
After a meal, cholesterol is absorbed into the blood circulation and is then packaged inside a protein coat. This cholesterol protein coat complex, called chylomicron, is then transported to the liver. Cholesterol synthesized by the liver, as well as any excess dietary cholesterol in the liver, is transported in the serum. Cholesterol is insoluble in water and is packaged in special molecular complexes called lipoproteins, synthesized by the liver in order to be transported in plasma. The lipoprotein particle is composed of an outer shell of phospholipid, which renders the particle soluble in water, a core of fats called lipid, including cholesterol, and a surface apoprotein molecule that allows tissues to recognize and take up the particle.
Application of the medicine. Transcatheter aortic valve repression is a minimal invasive procedure that replaces a narrow aortic valve that cannot open properly. In this procedure, doctors insert catheter into your left chest and guide it to your heart. In the medicine, this due to well-described complications of angiography, vascular surgery, thrombolytic therapy, and the more recently TAVR, and the patients are treated with oral prednisone and statin.
Transcatheter aortic valve replacement, or TAVR, is a less invasive catheter-based procedure. It is revolutionizing cardiac care and reducing the need for traditional open-heart surgeries. It's a treatment for aortic valve stenosis. That's when the aortic valve in the heart functions poorly, usually due to calcification, reducing blood flow throughout the body.
We don't take out the valve in the patient. We just move the valve or the stuck leaflets out of the way without having to make a surgical incision at all.
A typical TAVR involves inserting a guide wire into the femoral artery and threading it through the aorta, then around the aortic arch and into the stenotic aortic valve and left ventricle. A common TAVR procedure involves delivering a new valve with a balloon catheter over that guide wire and into the stenotic valve. The balloon is then inflated, opening up the old valve and putting the new valve in place. The wire and catheter are then removed, leaving behind a new, functioning aortic valve. Here you can see the new valve opening and closing and able to restore normal blood flow.
The recovery for those patients, especially those patients that are older, is much faster. Most of our patients stay overnight, and almost everyone goes home within 48 hours.
Cardiologists at UC Davis Health were the first in the Sacramento area to offer TAVR. They continue to lead the way in providing groundbreaking treatment options to patients with heart and vascular disease.
To have the opportunity to provide a minimally invasive procedure for those particular patients who need it is really life-changing for many of them.
Visit health.ucdavis.edu and Search for
Pros and cons. Pros. Detecting this pathology is time will allow the current medical intervention, reduces the high complication rate in association with the disease. Cons. Not detecting this pathology in the time can cause an organ damage by mechanical plugging and add inflammatory requests. The patients may have multi-ischemic dilation of the involving multi-organs. The patients may manifest fever, cachexia, kidney failure, amoris, cerebrovascular accident, digestive blending, etc. Patient may have a model-looking purple discoloration of the skin of the toes.
Heart disease is the #1 killer in North America. Most of us know that high cholesterol is a major risk factor. Exercise, eating right, and medications can help get your cholesterol numbers down. But for some people, none of those things work. Doctors at Mayo Clinic say those people may benefit from a new cholesterol-absorbing machine that removes bad cholesterol from your blood.
Well, I've always liked motorcycles, and I've just been riding them as long as I can remember.
But Martin had to put the brakes on riding when he had a quadruple bypass. His arteries were becoming blocked because of dangerously high cholesterol levels.
The highest I've ever seen was 380.
Martin tried hard to bring those numbers down. He was fit, he exercised, ate right, and took cholesterol-lowering medication.
And still my cholesterol was really high.
You see, usually your liver absorbs cholesterol and stores it, reducing bad cholesterol, or LDL, to levels where lifestyle changes or medications can manage them. Martin's liver can't do that.
And therefore the LDL cholesterol has nowhere to go but to circulate.
Dr. Sergio Torloni says this makes Martin's risk of blocked arteries very, very high. But thankfully, a machine that absorbs bad cholesterol out of your blood is helping Martin stay heart healthy. It's similar to dialysis. The patient's blood is separated by a filter into plasma and other components. The machine absorbs the bad cholesterol from the plasma, then the plasma and other components are mixed together and put back into the body.
After the procedure, my numbers are really low. I mean, perfect, exactly where they should be.
Down to 140. Martin's blood gets filtered once every 2 weeks, a small inconvenience for life. Dr. Torloni says this procedure is not right for all patients with high cholesterol. It is almost exclusively used for patients who have a genetic condition, familial hypercholesterolemia, with LDL receptor deficiency. It can also be used for those whose levels are above 200, even though they've tried medications to lower them. Pre-approval from the insurance companies are needed. For Medical Edge, I'm Vivian Williams.
Use applied in Ecuador. Aortic stenosis is one of the common cardiac degenerative valve diseases, with a prevalence of the 1% in the patient between 65 and 74 years and the 2% in a patient 75 years of age. Conclusion. Cholesterol cruiser embolization showed the suspected in the elderly patients with the risk factor of the arteriomatosis and who have undergone invasive vascular procedures, anticoagulant or fibrinolytic therapy. An early diagnosis is essential to establish early treatment and try to avoid serious complications. Due to the frequent skin involvement, the dermatologist is essential in the diagnosis of the CHD. Biopsy of the skin lesions is a reliable diagnostic mode with the less complication. Thank you for watching video, guys.